All right, we're going to be doing hip range of motion. Again, I always like to do a side that's not bothering them first. With him, I'm just going to be showing how to do that, but I always say it's this one, right? If they say yes, I'll go, I'm going to be moving this one first. They know and then just forget. And then when I go back to the side that is hurt, I'm going to say I'm going to be a little bit slower on this side. Remember, slow at end range makes friends, fast at end range makes enemies. They want to know that you're not about to do the exact same thing over here. You're just getting an idea of how it felt over there. We're going to spend time here. So patient handling is important here. You don't want to just grab their foot and go like that. You know, this just, I mean, it gets the job done, but it doesn't look good. Now, obviously, that's an exaggeration. You don't even want to be here because look at all that knee flexion. Maybe you've examined their knee and you know they're all right with it, but just get in a habit. So if you ever forget to ask a question, that you don't make mistakes. So I pull up like this. So I pull it up like that so I get it up there to me. I don't want to just let that dangle there. I pull it up like this, and then I'm going to raise it up like this, and then I cradle. It's close to me, have them right here, and now I can feel everything. And you want to see, is there any drift? Sometimes the shape of in the direction the acetabulum is and the femur. Can I go straight? And then does it drift out some? Most people have a little bit of drift. He doesn't have much, but some people you don't go very far there, but then they can get all the way right there. That's good to know. So you want to feel how it is. And if they say it hurts, you want to know where. Is it up front? Is it in back? In their hip? Is it in back? Is it on the side? And you want to make sure that's reproducible. If you go like this, they say it hurts on the side of their hip, and you do it again, like, oh, no pain now? Okay, this is a quick thing. It's got to be reproducible. I then like to do internal rotation because this is such an important one. So I rotate them like this. I don't want to just come out here. It's cranking on the knee. I may need to do that, as I see how it is. Right there, okay. That way I'm getting some pressure right here on the femur. I'm dropping my pen. And that way I'm rotating there with some pressure on the femur, but also with this a little bit. Sometimes you'll have people that come back next time, my knee was sore after last time. That's because you're cranking on their hip with, through their knee. Then I'm going to go this way. Again, grabbing here and rotating. A little bit of help with this arm on the femur there. When it's easy for it to come out like it was there, you can also bring it in. You just want to know what's the difference. Does it come a lot more there than right here? And we also, when we do hip abduction, possibly looking at the adductors or just range of motion of the hip, this hand is where most of the pressure is. It's proximal to the tibiofemoral joint. If I just pull out here, it doesn't bother him too much. But some people, especially if they're having hip OA, probably some knee OA, and it could be sensitive. I'm going to pull right there, and this one's barely doing anything, so I support with my leg there, and I walk it out. This will naturally externally rotate. That's fine, but then see what it without, if they without any external rotation, they just go to right there. But then with, they go out a lot more. That's limited, even though they're getting out there. So just play with it. Feel the quality. Can we internally rotate a little bit right there? Now, we're going to look at extension. I have Logan lie on his stomach. I'm not going to get him anything for his face like right now, but I do like to have something under their forehead. So what I want to do is look, does it look like just laying there pops them up because I don't have enough extension? For him it doesn't. Watch for that. Again, I'll do this both sides. I'll show you on this side. I want to grab right here under their femur, but I'm supporting this part of their leg with my arm. And then this hand feels. Right there I'm starting to get some lumbar extension. I want to feel right there. And notice I'm not just right here making him keep his leg extended. I'm right here supporting the femur and the tibia right there. Heavier leg, this is harder. Notice I lift with my body right there. I always like to see how quadricep flexibility is there. Sometimes that puts them into a lot of hip flexion. So maybe that rectus femoris is pretty tight. And then I like to do internal rotation. Notice I put my hand right here near the SI joint. Block that a little bit and see. Be careful though, this is cranking on that knee. You can come down here and try to hold with the femur a little more. I just don't crank on this one real hard, especially if I'm more worried about their knee if they've had any knee pain. Now extension with prone favor. I'd like them to be able to have this foot right on the popliteal fossa, and then right there, and then I'm going to lower this. So I got the greater trochanter right here. I'm going to put my hand right here to push down. If you're out here to the side, it'll rotate more. Over here, you just don't get as much extension. You just kind of want to have it sit. Some people are sensitive back there, so see how that is. If they say it hurts, where? Right where your hand is? Sometimes deep here, sometimes just up front. And then if you wonder if it's just the pressure, poke right there. Is it painful just to touch right there? Or do we, is it, no, just when you are starting to move it, and then give you better details. I like to put my leg right here to block that from coming up. Or you just put one hand right here. I prefer to have two hands there. But I sometimes, if this one's really coming up and it's starting to move up the leg and it's really tight, I'll just put one hand here and one hand here. And that's the good hip range of motion exam.